whatever, whether it's vaccines, whether it's treatments, let innovation continue. But if we can use an old medicine already, which is available cheap, then we should do that. Why not do both? I mean, would you be in favor of both? Are you
yes,
dead against?
I would absolutely. But I think perhaps the issue might be that the new medicines are granted emergency use authorization. So if there are effective, safe medicines, then perhaps that emergency use authorization would fall away. And then the, in some countries, it might be that the vaccines are not allowed to be given emergency use authorization. The other thing is, the WHO has a program called the ACT Accelerator program, which is access to COVID treatment accelerator. And in this, they're asking for $38 billion to support research into new therapies and vaccines. So there again, I wonder, would that really be necessary to ask countries for that kind of investment if they had safe old treatments?
So WHO is raising money to be given to the pharma, or who's going to do the research with 38 billion if they are able to raise that money?
Well, the partners include the Wellcome Trust and the Bill and Melinda Gates Foundation, the World Bank, and some others. So it doesn't necessarily specify where that money will go. I'm not aware of where the money will go. All I'm aware of is that they are raising this large sum of money for development of the vaccines and novel treatments. And on the program, it really does seem like repurposing medicines are completely ignored.
So what is the position of people like the Gates Foundation and Bill Gates himself concerning this repurposing the old medicine that seems to work versus spending billions of dollars on new patents for new medicines? How do they play into this?
Well, one has to wonder if Bill Gates says that there'll be no end to lockdowns until everyone in the whole world is vaccinated. It suggests that he has a particular position that wouldn't really be interested in effective old treatments. So I think that's a question to ask him, really, what his position is on ivermectin. But,
he's so idolized by all the media. When he comes on an interview, they sort of treat him like, the whole thing is like a good PR thing for him. I like the man. I think he's an innovative person in technology. He's done a lot for personal computing and things like that, and given away a lot of his wealth for a foundation for charitable purposes. I like all that. But I don't like his meddling with science. He's not a medical scientist. It's one thing for him to, as a philanthropist, to give money and put medical people in charge and let them come and defend whatever they want to defend and not take sides himself. I would have admired Bill Gates even more if he had said, listen, I'm going to bring in Dr. Tess Lauri, and I'm going to bring in this other person from here who's got a different view. And I'm going to basically, I have enough money. I'll support each of them to pursue whatever they want to do.